Well, good morning, everybody. I appreciate you taking some time out of your schedule to sit down with us and to discuss long-term care insurance and how that can play a vital part of your financial planning structure. For those of you who don't know me, my name is Jason Fial. I'm an investment advisor here with Wilde Wealth Management Group, and I take this topic near and dear to my heart. Long-term care is a vital part of anyone's financial plan, and we think this is a very important topic to share with the group. So we hope to not take up too much of your time this morning, but we do think it's going to be important to cover this topic kind of on a broad basis. And then if you guys have any additional questions, we would certainly recommend that you talk to your advisor and kind of carve out how this could look for your overall estate and financial plan. So again, for those of you who don't know me, Jason Fial, I've been with Wilde Wealth for about 4 years. I've been in the financial planning industry for 17 years and really enjoy working with families such as yourselves to kind of build the right financial plan. And insurance is part of that. So let's kind of get into just the topic to start, and then I'm going to tell you a little bit more about our group as a whole if you are not currently a client or maybe are a new client and don't understand kind of the depth of what we do at Wilde Wealth. So with long-term care insurance, it can certainly be a very expensive proposition for your resources. People, quite frankly, don't quite understand the number of people that actually need care. And as our baby boomer generation continues to age, that number will just go up. So it's critically important to have some form of a plan in place, whether that's self-insuring or using insurance to protect your assets. So that's what we will cover today in some details in regards to that. So I'm going to move forward with some of the details on our group and our team. So we have several offices here. Wilde Wealth Management Group has about 7 different offices in the Valley. We have several advisors here in our Scottsdale office that we are showing here on the slide. We have an investment team as well that helps support the advisors in building portfolios for our clients. So we have kind of this team here in Scottsdale. We also have, again, several other locations. We have an office in Glendale, an office in Payson up north. We have an office down south in Tucson, an office in Tempe, and then we actually went out west into California and have an office in beautiful San Luis Obispo. In terms of our client service team, we have a great staff here. I think, quite frankly, probably best in the business. They support us tremendously. They support you folks as our clients. So here's our client service team here in Scottsdale. We have an administrative team as well that helps with several other pieces to running an operation like this, and they're all vital in terms of what we do as a group and really help us run our business efficiently. We also have some affiliates that don't share the Wilde Wealth Management name, but they are part of our group. And so we're showing that here. We have several different affiliates. I'm not going to go through all of those, but we have several partners that work with us through Cetera, but they don't brand the Wilde Wealth name, but they're great partners with ours. We also have some business partners. So for some of the newer clients, or maybe folks that are tuning in that aren't clients currently, we're not just a wealth management firm. We think it's very important that we have other resources under our roof that we just don't have the expertise or the licenses to discuss. So we have a CPA in our office here in Scottsdale, who's Mike Patinella. We have a college aid planner, JD Wyzalek, who helps with college aid planning. We have a realtor and mortgage broker, Casey Taylor. We have Lisa Martin, who helps out with health insurance and Medicare. We have an estate planning team, Phelps LeClaire, which helps a lot of our clients with wills and trusts and all sorts of estate planning needs. Then we have our own branded Wilde Wealth Insurance Group with Taylor, who helps on the property casualty side, auto insurance, home insurance, et cetera. So really, as a financial planner, all of these pieces are really important. So we want to make sure that we have professional vetted resources that we feel comfortable recommending to our clients. In that way, they have someone that they can simply ask questions to or do business with if they choose to. So let's get into the meat of the topic here. And, as I mentioned before, long-term care is a critical part of what I do for my clients, or at least having discussions. And most people that I have discussions with really don't quite understand, how critical it is to have some type of plan in place to address this. And they don't understand how prevalent really it is, especially with a baby boomer generation. So over the next 18 years, approximately about 10,000 baby boomers turn 65 every single day. So it's sometimes hard to wrap your head around that number. So to help with that, that's essentially one every 11 seconds. So essentially there's going to be a lot of pressure on the healthcare system and the cost for these types of services. And we think it's really important for people to understand, especially people who are baby boomers now, that the cost for care and the need for care will continue to increase over time. So I think it's important that people understand that. And it's important to really kind of have a plan in place to really address that. In addition to that, so every 11 seconds, you've got a baby boomer turning 65. Really, how fast is that? Well, in 2020, which was 2 years ago, there will be about 3.5 working age Americans for every individual in retirement. By 2060, so we fast forward 40 years, there will only be 2.5 working Americans for every individual in retirement. So that causes pressure on a lot of the systems that we use publicly and government ran, that people have to be aware of. So the one thing I've understood very well that most, I think, clients don't really understand, because they don't want to think about it, is what's the odds of needing care, right? And most people I've talked to over the years say, well, the chances of me needing care are very low, so it's not something I want to address, and it's not accurate at all. Typically, about 70% of people are expected to need care at some point during their lives. So really, 2 out of 3 people will need some form of care in their life. If you're married, the chances are at least one of you, if not possibly both of you, will need it at some point. So it's not something that may happen. More than likely it will. And it's critical to figure out, well, how do we address that risk and the cost that's involved? And these are numbers we take from the U.S. Department of Health and Human Services. So they're as accurate as they can be. So it's really hard to predict, what type of care any person will need, how long you'll need it. What we can tell you is that statistics will say that the average person will need care for about 3 years. Okay. Women typically outlive men, so they need it for closer to 3.7 years. Men are about 2.2 years. And then 20% will need it for more than 5 years. So as we get through the rest of this presentation, you're going to see some of the cost involved for care. And when you start considering that 2 out of 3 people will need it, and the average person needs it for 3 years, it's really important to figure out how we're going to address this risk. So really understanding long-term care, what is it? How much does it cost? And really, what are my options, right? So we're going to address that here, and hopefully you'll have a better feel for what all these pieces mean in regards to the long-term care topic. So what is long-term care? Long-term care includes skilled nursing care, such as rehabilitative care after an extended hospital stay. But that's one type of care that's needed. It also includes assisted living facilities. So these, and most people probably understand what assisted living facilities are, what they're meant for. But these are environments for individuals who can no longer function independently, but don't need daily care, right? So you just need help with certain things, and these facilities can help with that. It's kind of your occasional help with what we refer to as activities of daily living. So activities of daily living include bathing, dressing, eating, transferring, so kind of getting in and out of bed, and walking. Long-term care can also include home health care. And I think this is mostly the preferred if we all had it our way, where you have home health aides come into your home and take care of you in your own home, so you don't have to leave your home, but you still get the care that you need. And this is, again, helping with just your basic activities of daily living. So helping with prepping meals and budgeting and cleaning your home, helping with medications, even transportation in some instances. So that's home health care. And then also there's respite care, which essentially is just kind of a temporary, occasional break for family members who are helping, their parents essentially with their care needs. So here's kind of the shocking statistic that most people are unaware of, and this really makes it challenging if we don't have a plan in place to help people with what happens if they need care, right? And what's the cost? So it really varies by state and by region, but the national average, this is for assisted living centers, for single occupancy is $48,000 a year. The average cost of a skilled care facility, again, just for one person, so these are what we call nursing homes, where you need more care, is much higher, and it's slightly over $100,000 a year. Now, the price can range very widely from state to state. I think we know that with lots of things and goods that we purchase. So some areas, Utah and Missouri, for example, are somewhat lower than the national average. And then other states like New York and California are quite a bit higher. You can see New York, the assisted living price tag is $60,000 a year. Nursing home is $146,000. And then on the low end, you have Missouri at $34,000 for assisted living, and nursing home at $66,000. So they vary quite a bit. The point being is it's very expensive. And if there's a 70% chance that you will need it at some point and need it for 3 years, we can do the math and say, here's the hole that we have in terms of care need. And then, how do we fill it, right? What's the most efficient way to cover that need? So really, there's two options. You can self-insure, right? Or you can purchase long-term care insurance. So let's take a look at both of those options. So really with self-insuring, you're self-insuring the cost yourself, okay? So by self-insuring, you're going to be using your personal savings, your investment accounts for any long-term care expenses. The neat part is it gives you flexibility. You can choose where to take the funds from at any point in time to pay for the care. But the expenses, as we have just seen, is it can be very high. And so if you have the funds to self-insure, it's okay. It still doesn't mean it's the most efficient way to do it, but it's an option. For some people, they don't have the ability to self-insure. So remember, the national average for assisted living is $48,000, and skilled care, meaning nursing homes, is $100,000, right? So again, very expensive. In fact, the self-insured choice, sometimes many people make by default because they just don't plan for long-term care. And that's the biggest challenge I've seen as an advisor over the years is it's just something we don't want to talk about, right? No one wants to think about getting old. No one wants to think about needing care. And they don't do anything about it. What I can tell you is, unfortunately, most people that don't have a plan for care, the likelihood of them transferring any wealth to their beneficiaries minimizes significantly, because most of their net assets will be going to the nursing home and not to their kids. And the goal is to try to figure out, how do we get the assets that you've accumulated and worked hard for all of these years over to your children and not to the nursing home, right? And that's the challenge that we foresee, but it's something that if we discuss and map out, we think we can have better results. So I want to go over a scenario here with you where you can kind of see the math here, and it's staggering, quite frankly. So this is if you self-insure and what the impact would be on your retirement assets, okay? So this chart shows $1 million retirement portfolio generating a 5% rate of return, okay? It assumes a 65-year-old couple will be withdrawing $50,000 per year, and adjusting it 3% each year to account for inflation. Okay. So if all goes as planned, their retirement portfolio has the potential to provide income until they reach 92. That's the line that's drawn out to the far right, where it shows neither spouse needs long-term care. This would show $1 million at that withdrawal rate lasting until you're 92 years old. Now, however, if one spouse spends the first 5 years of his retirement in a nursing home, which we're showing in the left line, the portfolio's income changes significantly. So the hypothetical example assumes a couple will spend $117,000 a year. That's including the long-term care cost and the expense to live, and increasing at 3% each year for the first 5 years while the spouse requires long-term care. So as you can see, what it does is it essentially shortens the span of your assets, your portfolio, to age 83. So in this example, it's showing if one spouse, if married or if you're single, you need long-term care insurance, it will deplete your portfolio 9 years sooner. And for most, that's a significant difference because most will still be alive in their early 80s, especially with life expectancies continuing to increase over time. So one of the questions I always get is, what about Medicare? and what does that cover, right? And Medicare can help a little bit, but it's really a drop in the bucket. So Medicare only offers really a small solution to the long-term care problem. Medicare does cover skilled care nursing home, but under very tight restrictions. So you have to have stayed in a hospital for at least 3 days and be discharged directly to a skilled nursing facility. So in a hospital for 3 days, then directly to a nursing home for Medicare to cover any of it, okay? But Medicare does not cover any custodial care. So under these conditions, Medicare will cover the first 20 days completely. For the next 80 days, it will cover all but a deductible. And after 100 days, it doesn't cover anything, okay? This assumes, of course, that you find a skilled nursing facility that accepts Medicare and other conditions are met. Now, keep in mind, even if there was some coverage for 100 days, the average person needs it for 3 years. Okay, that's over 1,000 days. So Medicare would cover less than 10% of that cost. So it helps, but if you're relying upon Medicare to cover your long-term care expenses, I think you'll be disappointed. So really, what are your other options, right? And so we've talked about self-insuring. The next piece would be long-term care insurance. And it's going to cover your skilled care, your custodial care, your in-home assistance. So your assisted living, your nursing home, and your in-home care, okay? So the idea of insurance in general, including long-term care insurance, is you're transferring the financial risk of the cost for care to the insurance company versus you self-insuring it yourself, right? No different than auto insurance, home insurance, business insurance, health insurance, et cetera. This is another form of insurance. And it can be very helpful if you purchase the proper policy to protect yourself and your loved ones from the cost of long-term care, because it can be quite high, as we've discussed earlier. So pros and cons to considering long-term care insurance. I think it's important to at least just cover these at a broad level. So on the pro side of the ledger, a long-term care insurance policy protects your assets, okay? You won't need to dip into your retirement savings to cover the cost of care, or if you do, it's at a fraction of what you'd be dipping into if it was coming from your pocket and you self-insured, okay? And under certain conditions, your premium may be partially or completely deductible. That would be a conversation to have with your accountant. But long-term care insurance covers other things and gives you other advantages as well. In the event of a long-term illness, it will enable you to preserve your dignity. You can maintain your standard of living for as long as possible, your independence, which doesn't get talked about, but is really important for people that are going through this event. You can preserve your choice. You can choose where you want the care. And really, I think the most important thing for most is, besides the financial pieces, they just don't want to be a burden on their family. And having the care by someone other than your family, a professional, I think is very, people feel much more comfortable with that ability or that option. On the con side, you have to be sure that you understand that these premiums aren't cheap. And I always explain to people that when an insurance company charges you a premium, if the insurance premium is really inexpensive, then the risk is very low. If you have an expensive insurance policy, then the risk is high, and the insurance company has to charge a higher premium to cover that risk. So the premiums typically are fairly expensive with long-term care, and you need to be sure you can pay it. You don't want to pay these premiums for 5, 10, 15, 20 years only to let it lapse because you just can't afford it later in life. So they're very customizable, but the premiums, regardless of which option you choose, can be very expensive. And the policies are very complex. As I mentioned just previously, there's lots of different options. There's a lot of different benefits, different benefit periods. So it's really important that if you are interested in having this discussion about long-term care insurance, you speak with your advisor who understands the benefits and knows your situation and knows specifically how can we design possibly a policy that you can afford and that will give you the right coverage that you need. And again, choosing a long-term care insurance policy, you've got to understand it's an insurance policy. If you ever purchased an insurance policy and looked at the policies, there are 50 pages of insurance jargon that nobody wants to read or understand, right? So you have to understand that there are some limitations and features of the policy. So understand what those are. In most cases, policyholders cannot collect benefits until their disability reaches certain levels, okay? And most policies specify how much they will pay for each day of care and for how long. For example, you can buy a policy that will pay up to $200 or $300 a day for care, whether you're at home, in a nursing home, or at a facility, okay? Second, you have to look at the type of care covered. Long-term care policies can cover everything from skilled care to nursing home to custodial care in your home. They all can offer different benefits, and the more rich the benefits, the more rich the premiums are. You have to figure out, what am I looking for, okay? And third, you have to look at the total benefit. So you don't want a policy that's going to run out of benefit when you still need it, right? And you don't want to pay for coverage that maybe you don't need. So again, you work with your advisor to figure out, here's what makes sense for us financially, and now help me design the right policy that might make sense for us, okay? You also have to understand there's waiting periods before benefits start. Usually most policies have 90-day waiting periods, but you can change those. So once you are diagnosed needing care by a doctor, then the benefits start 90 days later. You want one that's renewable, that can't be non-renewed. That's very important to have. And then you also have to consider inflation protection. And discussing inflation now, people are more aware of inflation, right? We've had low inflation for 15 years. Now we have extremely high inflation, the likes that we haven't seen in 40 years. And healthcare, quite frankly, runs typically almost double normal inflation. So, if we have a policy that will pay for care at the clip today in a nursing home, but you don't need it for 20 years, then really it's going to cover maybe half of what you need in 20 years. So looking at inflation coverage is very important to add on to these policies. So really that's kind of the gist of the topic today in the conversation, is just kind of understanding, the risk for long-term care insurance is much higher than most people, I think, are aware of. I think it's much more expensive than people are aware of. And most importantly, just understanding, what options could potentially work for me. Do we self-insure? Do we consider long-term care insurance? It's really customizable. It's different per family. Each family has a different need. So I strongly encourage you to speak with your advisor about this topic if you haven't had that conversation yet, because long-term care insurance, if you don't have some form of a plan in place, can leave a massive hole in your financial plan. And it's going to happen to more people than I think most people want to admit or think about. So it's something that really needs to be addressed, and we are here to help in any way that we can. Again, so with that being said, Jason Fial, Wilde Wealth Management Group, we appreciate your time today. And we all hope that you guys have a good rest of your day and week. Thank you much.